Hello parents, myself Dr. Anupriya. So this course is a guide about baby's pee and poop. So first we'll learn about the basics of baby output and then what's normal and abnormal about baby's pee and poop and when to see a doctor. Here is what you'll learn with me today. So first we'll cover the baby's pee and how can you use the wet diapers as a reliable indicator about your baby's hydration. You'll know exactly what to look for to be sure that your baby is getting enough milk. Next, we will decode the fascinating world of baby's poop. We'll explore different colors and textures for both breastfed and formula-fed babies so that you can know what is normal for your unique baby. And most importantly, by the end of this course, you'll be able to confidently spot the red flags that truly needs doctor's attention, separating the common concerns from the genuine warning signs. Now, what's normal in baby's pee? So, babies should pass the first urine within 48 hours. In the first couple of days, baby may have just 1 to 2 wet diapers. But once your milk comes in, that is within 3 to 5 days, the number of wet diapers increases. The goal is to look for 6 to 8 times or even more in 24 hours. A properly wet diaper feels heavy. This is a reassuring sign that your baby is getting milk well and is hydrated. The normal color of urine is pale yellow or colorless. This confirms that they are drinking plenty. A special note on the pink stain or the urate crystals. Now this is something that can cause a lot of worry. But remember, it is usually normal in the beginning. So what happens is you might open the diaper and see pinkish or reddish chalky stains over the baby's diaper, just like brick dust. So these are called urate crystals. They're just concentrated urine and is common in the very beginning, especially in the breastfed babies, as your milk supply gets established. If you see this once or twice in the first 3 days, you need not worry. But if it is persistent and present beyond day 4 of life, it's a sign that your baby needs more milk. So this is a good time to check with your pediatrician or a lactation consultant to ensure feeding is on track. What's abnormal about baby's pee? So reduced urine count. So if the baby is passing less than 6 times in 24 hours, it is not normal. It is the most common sign of dehydration. If baby's urine is not pale yellow, it's dark colored, amber color or orange, it's a sign that urine is too concentrated and your baby needs more fluids. Dark yellow urine, it may be a sign of jaundice. You need to see your doctor. Strong foul smell. Newborn pee usually has a very mild odor. If you see the baby is having a very unpleasant odor, it might be a sign of infection. Pain or discomfort. If your baby cries or screams while passing urine, note that it's while passing urine. Usually babies cry before passing urine. That is due to the discomfort which they feel due to the bladder stretch, and after passing urine is due to the wet diaper. So if the baby is crying while passing urine, it needs to be investigated. Blood in urine. It is very rare, but if you ever see streaks of blood or pink or red blood in the urine, this is very rare, but if you ever see pink or red streaks or spots of blood in the urine, you should see your doctor right away. So next we'll talk about baby's poop. So baby should pass the first poop within 24 hours and it is called as meconium. It's jet black, thick, sticky, tar-like. It can get a little difficult to clean off. So a little bit of petroleum jelly or coconut oil over the wipes can help you clean. After the meconium passes, your baby's poop will transition to what we call as transitional stool. It's a mixture of both meconium as well as milk poop, which is usually greenish brown, and then it settles into the regular pattern. And this is where we see a major difference between the breastfed and formula fed babies. So for our exclusively breastfed baby, their poop is often described as mustard yellow and it can be sometimes greenish as well. The texture is typically loose. You may as well see white flakes, which we call as seedy or curdy. It can be quite watery, which is normal. The smell is generally mild and not unpleasant. Now the frequency. This is where it gets interesting. A breastfed baby might poop after every feed or may go without pooping for several days, which is completely normal, which can be up to a week to 10 days. This is because breast milk is so perfectly made that every little thing gets digested and a very little product is left for waste. As long as the tummy is soft and they are comfortable, nothing to worry. Now for a formula fed baby, the poop is generally a bit different. The color is a shade of tan, greenish brown or yellowish brown. The texture is noticeably thicker. It's more of a paste, often compared to that of peanut butter. The smell is more pungent and smells more like a typical poop. Formula-fed babies tend to have a predictable bowel movement at least once a day, can go up to 3 to 4 times a day. It's less common for them to skip several days. Now, which colors are normal? Yellow. This is the classic textbook color of breastfed baby's poop. If you see mustard yellow, everything is grey. Brown. Any shade of brown, from tan to darker brown, is normal. This is typically the color of a formula-fed baby and will become the standard color once you start varieties of solid. Next is green. Now when a baby passes green poop, most of the parents get worried, but it is usually normal. A bright green frothy poop in a breastfed baby can sometimes mean that the baby is taking more of watery fore milk than the fatty hind milk. But it can also be caused by several other things, like the mother has eaten green leafy vegetables, if the baby is on iron supplements, or if the mother is taking, or just faster digestion. If your baby is happy, gaining weight, there's nothing to worry about. A green poop is just a normal poop, and it's rarely a cause of concern. Now, what are the abnormal poops? So in terms of color, red. Seeing red streaks or frank blood in the stool is not normal at all. It is alarming. Sometimes it can be due to a cut on your baby's bottom, which is called as anal fissure, or can also be due to the crack over your nipples. Can be a milk protein allergy or any infection of the gut. So whenever you see blood, it is an alarming sign and you need to see your doctor immediately. Try to save the diaper or take a clear picture of it. White, pale grey or chalky. This is a significant red flag. So the poop's brown or yellow color comes from the bile, which is secreted by the gallbladder, produced by the liver. So a white, pale grey or chalky stool means that the stool has not received the bile. That means there is a serious issue with the gallbladder or liver. So it's an alarming sign and visit your pediatrician immediately. Black. So once the meconium stage passes, black colored stool can be a digested blood which is coming from above in the digestive tract. The exception is if your baby is taking any iron supplement, which can cause the stool to have a darker color. But otherwise, poop which is black in color needs immediate attention. In terms of frequency, if the baby has not passed stool for more than 10 days or the baby is passing more than 15 to 20 times a day, both are concerning. Consistency, if the baby is passing watery poop or hard poop which is pebble-like or sticky oily poop, that can be a sign of fat malabsorption. So, coming to the summary, a baby should be passing at least 6 times urine in 24 hours. Lesser than that is a sign of dehydration and means that your baby is not getting adequate milk. When it comes to stool, a breastfed baby might pass stool after every feed or may not pass for 7 to 10 days. Both are normal. But if you see blood or white chalky stool or black stool when the baby is not on iron supplement, it is not normal. And if the baby is passing watery stools for more than 15 to 20 times a day, seek doctor's help.